vitamin D is it's so important for so many things. And I'd encourage you to checked to see whether or not your vitamin D level is low. It's surprising living here in Southern California that the majority, I would say more than 80% of the patients that I test are deficient in vitamin D. It's very, very interesting. And we are in a very sunny area of the United States. With that being said, I again recommend that you get tested for it to see where your level is at, and then use that as one of the others. The other ones I would leave up to the specific condition. If it is something that I'm talking with the Arthritis Foundation today, so I'm thinking that the anti-inflammatory aspects, the osteoarthritis, rheumatoid arthritis would be the ones that you're after. Turmeric and boswellia are good ones to take. What's interesting, the difference between the two, I mean, they're both very great at being anti-inflammatories. The boswellia is a little bit more protective on the stomach than the turmeric. So if you think about anti-inflammatories, especially ones that are prescribed, the boswellia I would ascribe to being more similar to something like the celecoxib medication, which has a little bit more GI protective effect than some of the other anti-inflammatories out there. So if you are looking for one specifically for that, I would go toward that. Then if you're looking for something to treat pain and then potentially, any depression that could be going along with it, you might want to look towards some of the supplements that can also boost up the serotonin, especially if you're not taking an antidepressant. So something like the 5-hydroxytryptophan, would come to mind. If you go to the store and you're looking at a vitamin D3 supplement because you're vitamin D deficient, you can buy a 1,000 international unit, 2,000, 5,000, 10,000. It's just going to be dependent on how deficient you are. If you're not deficient, you may want to even consider taking it anyway. The data is conflicted. I'll tell you, even when you talk about the American College of Rheumatology and their recommendations for vitamin D supplementation, they look at a range from 40 to 60, but there are some folks that say you actually need to be higher than a level of 60 and bump it up there to be really protective. So it depends on where your reference range is. And again, I would encourage you to work with your own healthcare provider. And with that being said, there are some, I mean, we're not all the same, as you probably know, but there are some providers out there who may not be comfortable dealing with supplements or with vitamins. And so if that's the case, it would be okay for you to seek out someone who is. So if there is a naturopath or there is someone who deals with functional medicine or something else, that you just have another practitioner who's on your team and looking out for you and can give you good guidance on this. But don't hesitate to look elsewhere for somebody who's qualified. And not that means that your provider is bad or there's anything wrong with them. There are just some that don't have the education on this.